Get the most out of your hard work with this essential lesson on understanding your score and next steps for success. You studied hard, showed up prepared, and took the CNA exam. Now what? Understanding your score and what comes next is just as important as passing the test itself. Whether you passed or didn't, this lesson will help you. Know how and when to access your results. Understand what your score means. Learn how to move forward, pass or fail. Take smart steps towards certification and employment. CNA exam structure. Quick review. Let's break down the two parts of the CNA exam so you understand what's being scored. Written or oral knowledge test. Typically 60 to 70 multiple-choice questions. Tests your knowledge on topics like safety and infection control, communication, resident rights, activities of daily living, ADLs, mental health and aging. Scoring. Most states use a percentage system. The required passing score is often 70 to 80%, but this varies by state. Clinical skills test. Usually requires you to demonstrate 3 to 5 skills. One skill is always hand hygiene, hand washing. Other skills are randomly selected. Example, dressing a resident, taking blood pressure. Scoring. Each skill has specific steps, sometimes 15 to 25 steps. You must perform each critical step correctly and most non-critical ones. Mistakes on critical steps can cause you to fail that skill. How and when will you get your score? Timeline for results. Test provider Pearson VUE. Written test results is same day or within 48 hours. Skills test results, same day or within 5 business days. Test provider Prometric. Written test results is usually within 1 to 5 days. Skills test results, usually within 1 to 5 days. Test provider Headmaster TMU. Written test results is same day or within 2 to 3 days. Skills test results, usually within 3 to 5 days. Where to check. Log into your test provider's online portal, Pearson VUE, Prometric, or Headmaster TMU. Some states will mail results as well. Pro tip: check your email spam folder for result notifications. What will your score report include? Overall pass-fail status. Written test percentage, if available. Each skill's outcome, pass or fail. Notes on critical step errors if applicable. Recommendations for next steps. If you passed, congratulations. What comes next? Certification process begins. Your test provider sends your results to your state's nurse aid registry. This may take 5 to 15 business days, depending on the state. You are officially a CNA. Once your name appears on the registry, you're eligible to start working immediately as a CNA. You can print a copy of your certification. Some states send a physical certificate. Apply for jobs. Start applying for jobs in hospitals, nursing homes, assisted living facilities, home health agencies. Pro tip: many employers require proof of registry status, so keep your login info handy. Bonus tip: build your CNA portfolio. Include in your job application resume tailored to CNA roles, CNA certification and registry proof, letters of recommendation from instructors or clinical supervisors, copies of CPR or BLS certification if you have one. If you did not pass, don't panic. Common reasons for failing: missed critical steps in the skills test, didn't finish skills in time, scored below the required percentage on the written test, didn't follow infection control protocols. What happens next? Review your score report. Your report will explain which test you failed, written, skills, or both. What specific steps or areas need improvement. Whether you're eligible to retest. Schedule a retest. Most states allow 3 attempts within 2 years of completing your CNA training. If you fail all 3 attempts, you may need to retake your training program. Pay retest fees. You only pay to retake the sections you failed. Fees vary by provider, but usually range from written, $30 to $50. Skills, $60 to $100. How to prepare for a retest. Take a refresher course. Some schools offer these. Practice clinical skills with a partner or instructor. Use CNA exam prep books and apps. Watch videos demonstrating each skill step by step. Take mock exams to get familiar with the format. Pro tip: record yourself performing skills and critique your own steps. Common post-exam questions. How do I find my name on the CNA registry? Visit your state's Board of Nursing or Nurse Aid Registry website. Use your name or CNA certificate number to search. What if I passed one part but failed the other? You only retake the section you failed. Some states may require you to pass both within a certain time frame, usually 24 months from training completion. Can I work while waiting for my certification? Some states allow you to work as a nurse aide in training if you've passed one part. Check your state's policy for temporary employment status. Can I transfer my CNA license to another state? Yes, this is called reciprocity. Contact the new state's Nurse Aid Registry to submit a reciprocity application. You may need to show proof of active certification, a background check, current employment or training. Summary: CNA exam score and next steps cheat sheet. If you passed, wait for state registry to update. Print or verify CNA certificate. Begin job applications. Keep resume and documents ready. Celebrate your accomplishment. If you failed, review detailed score report. Register and pay for retest. Focus on weak areas, especially critical steps. Consider a refresher course. Stay motivated and try again. Final thoughts and motivation. Passing the CNA exam is a huge milestone, but even if you didn't pass the first time, remember, failure is not the opposite of success, it's part of the journey. Take what you've learned from your results and use it to bounce back stronger. Your future in healthcare is still right in front of you.